Universal health coverage, often abbreviated as UHC, is a concept that ensures all people have access to the health services they need, when and where they need them without suffering financial hardship. It's about making sure everyone, regardless of their background or income, can get quality health care. UHC covers a broad range of services from health promotion to prevention, treatment, rehabilitation, and palliative care. The goal is to improve health equity and protect people from the financial risks associated with paying for health services out of pocket. In this video, we'll explore what UHC means, why it matters, and how countries are working towards it. The heart of universal health coverage are three core principles: equity and access to health services, quality of care, and financial protection. Equity means that everyone, no matter where they live or how much money they have, can access the health services they need. Quality ensures that these services are effective and safe. Financial protection means that people are not pushed into poverty because of medical expenses. These principles guide the design and implementation of UHC policies around the world, aiming to create fairer and healthier societies. Universal health coverage is more than just a health policy, it's a foundation for social and economic development. When people have access to health care, they can live healthier, more productive lives. UHC helps reduce poverty, improves educational outcomes, and supports economic growth. It also strengthens communities by ensuring that everyone, especially the most vulnerable, can get the care they need. In many countries, UHC is seen as a key step toward achieving broader development goals and building resilient societies. Universal health coverage isn't just about treating illness, it includes a wide range of health services. These services cover health promotion, such as education about healthy lifestyles, disease prevention like vaccinations, treatment for illnesses and injuries, rehabilitation for those recovering from health problems, and palliative care for those with serious illnesses. By covering all these areas, UHC aims to address the full spectrum of health needs throughout a person's life, from childhood to old age. One of the main goals of universal health coverage is to protect people from the financial risks associated with health care. In many parts of the world, paying for medical treatment can be a major burden, sometimes forcing families to sell assets or go into debt. UHC aims to eliminate these hardships by ensuring that health services are affordable and accessible. This means reducing out-of-pocket payments and providing financial support for those who need it most, so that no one has to choose between their health and their financial security. Equity is a cornerstone of universal health coverage. It means that everyone, regardless of their income, gender, age, or location, can access the health services they need. In practice, this often requires targeted policies to reach marginalized or underserved populations, such as rural communities, people with disabilities, or those living in poverty. By focusing on equity, UHC helps close the gap between different groups and ensures that health care is truly universal. Universal health coverage is not just about access, it's also about quality. High-quality health services are safe, effective, and centered on the needs of patients. This means having well-trained health workers, reliable medicines and equipment, and systems in place to monitor and improve care. Quality is essential for building trust in the health system and ensuring that people get the best possible outcomes from their care. Primary health care is often the first point of contact for individuals within the health system. It includes essential services like checkups, vaccinations, maternal and child health, and management of common illnesses. Universal health coverage relies on strong primary healthcare systems to deliver services close to where people live and work. By investing in primary health care, countries can improve health outcomes and make the most efficient use of resources. Prevention and health promotion are key components of universal health coverage. This means not only treating illness but also helping people stay healthy in the first place. Programs like immunizations, health education, and screenings for diseases help prevent health problems before they start. By focusing on prevention, UHC can reduce the overall burden of disease and lower healthcare costs in the long run. Universal health coverage ensures that people can access treatment when they are sick or injured, as well as rehabilitation services to help them recover. This includes everything from hospital care and surgery to physical therapy and mental health support. By covering both treatment and rehabilitation, UHC supports people throughout their health journey, helping them return to their daily lives as quickly and fully as possible. Palliative care is an important part of universal health coverage, focusing on improving the quality of life for people with serious or life-limiting illnesses. It includes pain management, emotional support, and assistance for families. By including palliative care in UHC, health systems ensure that everyone can receive compassionate care, even when a cure is not possible. Major barrier to accessing healthcare is the cost paid directly by patients, known as out-of-pocket payments. Universal health coverage aims to reduce or eliminate these costs by providing insurance schemes, government funding, or other financial support. This helps prevent people from delaying or avoiding care due to cost and protects families from catastrophic health expenses. Countries use different models to achieve universal health coverage. Some rely on public health insurance funded by taxes, while others use social health insurance, where workers and employers contribute to a common fund. Private insurance can also play a role, especially for services not covered by public schemes. The key is to design systems that are fair, efficient, and accessible to all. Governments play a central role in achieving universal health coverage. They set policies, allocate resources, and regulate health systems to ensure quality and equity. Governments also have the responsibility to protect vulnerable populations and ensure that health services are available and affordable for everyone. Strong leadership and political commitment are essential for making UHC a reality. Universal health coverage is a global priority. supported by organizations like the World Health Organization and the United Nations. International cooperation helps countries share knowledge, resources, and best practices. Financial and technical support from global partners can accelerate progress, especially in low and middle-income countries. UHC is also part of the United Nations Sustainable Development Goals, highlighting its importance for global health and development. Tracking progress towards universal health coverage is essential for understanding what works and where gaps remain. Countries use indicators like service coverage, financial protection, and health outcomes to measure their success. Regular monitoring helps identify challenges and guide improvements, ensuring that UHC efforts are effective and responsive to people's needs. Achieving universal health coverage is not without challenges. Limited resources, workforce shortages, and unequal access to services can slow progress. Political, economic, and social factors also play a role. Overcoming these obstacles requires strong leadership, innovative solutions, and sustained investment in health systems. By addressing these challenges, countries can move closer to making UHC a reality for all. Innovation is key to overcoming barriers to universal health coverage. This can include new technologies such as telemedicine, mobile health apps, or digital health records, which make services more accessible and efficient. Community-based programs and partnerships with the private sector can also help expand coverage. By embracing innovation, health systems can reach more people and improve the quality of care. Health workers are the backbone of universal health coverage. Doctors, nurses, community health workers, and other professionals deliver essential services and support patients throughout their care journey. Investing in training, fair pay, and safe working conditions helps ensure a motivated and capable workforce. Strong health teams are essential for delivering high-quality, accessible care to everyone. Engaging communities is vital for the success of universal health coverage. When people are involved in designing and delivering health services, those services are more likely to meet their needs. Community engagement can include health education, local health committees, and feedback mechanisms. By listening to communities, health systems can become more responsive and effective. People living in rural or remote areas often face greater barriers to accessing health care. Universal health coverage seeks to close this gap by investing in rural health facilities, mobile clinics, and telemedicine. By bringing services closer to where people live, UHC helps ensure that everyone, no matter their location, can get the care they need. Urban areas can also face unique health challenges such as overcrowding, pollution, and unequal access to services. Universal health coverage addresses these issues by strengthening urban health systems, improving infrastructure, and targeting underserved populations. By focusing on both rural and urban needs, UHC aims to leave no one behind. Universal health coverage pays special attention to vulnerable groups, such as children, the elderly, people with disabilities, and those living in poverty. Tailored programs and targeted funding help ensure that these groups can access the services they need. Protecting vulnerable populations is essential for achieving true universality in health coverage. Gender can influence access to health services and health outcomes. Universal health coverage promotes gender equity by addressing barriers faced by women and girls, such as discrimination, lack of information, or limited financial resources. Gender-sensitive policies and programs help ensure that everyone can benefit from health services, regardless of gender. Children are a priority for universal health coverage. Services like immunizations, nutrition programs, and early childhood development are essential for giving every child a healthy start in life. By investing in children's health, UHC helps build stronger, healthier societies for the future. As populations age, the need for health services for older adults increases. Universal health coverage includes services for the elderly, such as chronic disease management, home care, and support for caregivers. By addressing the needs of older adults, UHC helps ensure dignity and quality of life for all ages. Mental health is an integral part of universal health coverage. Services for mental health include counseling, medication, and community support. By integrating mental health into UHC, countries can reduce stigma, improve access, and support overall well-being. Chronic diseases like diabetes, heart disease, and cancer require ongoing care and support. Universal health coverage ensures that people with chronic conditions can access regular checkups, medications, and education to manage their health. This helps prevent complications and improves quality of life. Access to emergency health services is a critical part of universal health coverage. This includes ambulance services, trauma care, and disaster response. By ensuring that emergency services are available to everyone, UHC can save lives and reduce the impact of health crises. Strong health infrastructure is essential for universal health coverage. This includes hospitals, clinics, laboratories, and supply chains for medicines and equipment. Investing in infrastructure helps ensure that health services are reliable, safe, and accessible to all. Accurate and timely information is vital for managing health systems and tracking progress towards universal health coverage. Health information systems collect and analyze data on service delivery, health outcomes, and resource use. This information supports decision-making and helps improve the quality and efficiency of care. Access to essential medicines and vaccines is a key part of universal health coverage. Health systems must ensure that these products are available, affordable, and of high quality. Efficient supply chains and regulation help prevent shortages and protect public health. Financing is a major component of universal health coverage. Countries use a mix of public funding, insurance schemes, and out-of-pocket payments to pay for health services. The goal is to mobilize enough resources to cover everyone while ensuring that payments are fair and do not create barriers to care. Universal health coverage encourages the use of cost-effective interventions, those that provide the greatest health benefit for the resources invested. This means prioritizing services that have a proven impact, such as vaccinations or screening programs, and making the best use of available funds. Universal health coverage is part of the United Nations Sustainable Development Goals, specifically Goal 3, Good Health and Well-being. Achieving UHC is seen as essential for building healthier, more equitable societies and supporting global development. Thailand is often cited as a success story in universal health coverage. Through strong political commitment and innovative policies, Thailand expanded health insurance to cover nearly its entire population. The result has been improved health outcomes, reduced poverty, and increased public trust in the health system. Rwanda has made remarkable progress towards universal health coverage by investing in community-based health insurance and strengthening primary care. These efforts have led to increased access to services, better health outcomes, and greater financial protection for families. Many high-income countries have achieved universal health coverage through different models, such as single-payer systems or mixed public-private approaches. These experiences show that there is no one-size-fits-all solution, but common elements include strong government leadership, broad risk pooling, and a focus on equity. Technology is transforming healthcare and supporting the goals of universal health coverage. Digital health records, telemedicine, and mobile apps make it easier to deliver services, track health data, and reach remote populations. Embracing technology can help health systems become more efficient and responsive. Raising public awareness about universal health coverage is important for building support and encouraging people to use available services. Education campaigns, media outreach, and community events can help inform people about their rights and the benefits of UHC. Achieving universal health coverage requires partnerships between governments, the private sector, civil society, and international organizations. By working together, these groups can pool resources, share expertise, and coordinate efforts to expand coverage and improve health outcomes. Monitoring progress and holding stakeholders accountable are essential for the success of universal health coverage. Transparent reporting, independent evaluations, and public participation help ensure that health systems deliver on their promises and continuously improve. Future of universal health coverage depends on continued innovation, investment, and commitment from all sectors of society. As health needs evolve, UHC must adapt to new challenges such as pandemics, climate change, and emerging technologies. By staying focused on equity, quality, and financial protection, UHC can help build healthier, more resilient societies. Universal health coverage is about ensuring that everyone can access the health services they need without financial hardship. It includes a wide range of services, focuses on equity and quality, and requires strong leadership and investment. By working together, countries can make UHC a reality and improve health for all. Universal health coverage represents a vision of a world where everyone everywhere can live a healthy life. By committing to UHC, societies invest in their people, strengthen their economies, and build a foundation for sustainable development. The journey may be challenging, but the rewards are immense: a healthier, more equitable future for all.